So we're sitting in a 400-year-old city hosted by a magazine in 2014 talking about enterprise software. And is it a good idea that we switch from paper to enterprise? Everything in all of our lives is on the internet. And we're deciding the puts and takes on buying frickin' Model Ts, payphones, like a better pay. Are you kidding me? And how will we get the data out? And how will we get all the different government, widgets to be lined up? The airbags have to be in place, and it sort of feels like that, and then the airbags don't work. The meaningful use screws up the doctor's workflow, but you have to have it in order to sell your car. My head hurts. This internet thing, I swear to you, is going to be big. Of course nobody should spend years installing things. Of course nobody should spend millions of dollars to generate a miracle. Negative labor productivity to technology investment. You can actually increase your administrative staff by buying labor-saving technology only in healthcare. It's a weird retro world. It's like Blade Runner, where in Blade Runner in the future, the cars fly, but there are still public phones.
Yes.
Right? So he goes up to do a video public phone. Remember Harrison Ford in the Blade Runner? I'm having a weird netherworld, fake future moment here. Survey about whether, it's absurd that all these hospitals are buying these islands, and medical groups, no offense, are buying islands of automation and then having their own little EMR departments, creating their own little patchwork quilts of their own little data set. And then, Texas Medical Center does Texas Health Resource does a beautiful job responding to a screw up, but they're this tiny little island of automation. Of course they weren't surveilling for Ebola in Dallas just right. When you go to do it, how many emergency rooms in the country have people who have diarrhea, muscle aches, and a fever right now?
So how are we going to get there?
We got to go to the internet. We got to skip
We've got to go to the internet.
software. We must connect care. Care must be connected.
He's
doing it. Allscripts is doing it.
What's standing between us and getting there?
The EHR business model. The word EHR, the notion of a noun as a piece of technology.
So
health information networks, right?
Okay.
We all need to assume ourselves to be health information networks. And there's 1,000 things that are in the way. There's an anti-kickback law that makes it illegal to have an interchange payment between a doctor and a hospital. That's retarded, Of course, if a doctor provides all of the information to register a patient electronically, prevents the person in the hospital from fat fingering it incorrectly, the doctor should get $5. You go to jail if they do that.